Well, welcome back. We're going to continue on with Chapter 9 and talk about explanatory and response variables. Remember that a response variable measures what happens to the individuals in the study, and the explanatory variable explains or influences changes in that response variable. In an experiment, we're interested in studying the response of one variable to changes in the other. Explanatory variable. So here we'll continue on with some vocabulary. What are subjects? They're the individuals studied in an experiment. The factors, they're the explanatory variables in the experiment. So if we were to do an experiment where we're giving someone a drug that helps to decrease their cholesterol level, the factor would be the drug that we use. A treatment is any specific experimental condition applied to the subjects. So if there are several factors, a treatment is a combination of specific values of each factor. For example, if I were to say I wanted to see the growth of a particular plant, and my two factors are water, sunlight, and fertilizer. And I could say that I would give the plants so much water. Let's say that I'd give it, depending on the pot of the plant, let's say a fourth cup of water. Another plant or another group of plants I'd give a little less than that, maybe an eighth a cup of water. Sunlight, I'd give one full, and then one just the morning sun, and one just the evening sun is another factor that I would look at. And then fertilizer. One I'd give natural fertilizer like manure. The other one I'd give a commercial grade. And then another one, none. No fertilizer at all. So those are three different factors. And my treatments would be, okay, I could do a fourth a cup of water to give to the plants in full sunlight using manure, or a fourth a cup of water in full sunlight using commercial fertilizer, and a fourth a cup of giving it full sunlight and no fertilizer. So I just gave you three different treatments. Now there's going to be a whole lot more treatments, but I just gave you three because I could also given three factors, I could have many treatments, many combination of the factors that I use on an experiment. So let's go through this example, effects of TV advertising. Now the objective was to determine the effects of repeated exposure to advertising message. So we're looking on, it may depend on the length and how often the advertisement was repeated. So there are two factors that we're looking at. Now the subject is a certain number of undergraduate students. All students viewed a 40-minute television program that included ads for a digital camera. Some subjects saw 30-second commercials, others saw 90-second commercials. The same commercial was shown either 1, 3, or 5 times during that program. So again, there are two factors, the length of the commercial and the number of repetitions of the number of times the person saw that commercial in that program that they were watching, that 40-minute television program. So here we're going to look at the treatments that could occur with these two different factors. So my first treatment would be to see a 30-second commercial only one time in that 40-minute span of time, or to see a 30-second commercial 3 times in that 40-minute television program, and so forth. So with the three different factors, factor B, the repetitions of the commercials, and factor A, the length of the commercial, we could get 6 different treatments. And as you can see, the more factors you have, the more treatments that you would get. Now after all these different treatments, so after viewing all the subjects answered questions about recall of the ad, their attitude toward that camera, and their intention to purchase it, these all were the response variables. So experiments should compare treatments rather than attempt to assess the effect of a single treatment in isolation. Problems when assessing a single treatment with comparison: you have conditions better or worse than typical, so there's a lack of realism. Subjects not representative of the population, and you can even have a placebo effect. So we don't just want to compare more than one treatment at a time. Not only do we want to compare more than one treatment at a time, but we also want to make sure that the comparisons are fair, so we randomly assign the treatments. Each treatment should be applied to similar groups or individuals. It removes lurking variables. Assignment of treatments should not depend on any characteristic of the subjects or the judgment of the experimenter. We don't want to put any kind of bias in here. So let's look at experiments. Basic principles of experiments. We want randomization. It balances out those lurking variables across treatments. We want to control the power of suggestion, so the placebo effect. And then we want to have a control group to understand changes not related to the treatment of interest, to see what happens when the group doesn't have whatever treatment is imposed on them. Now, in a randomized design, a completely randomized design, all subjects are allocated at random among all the treatments. So you can compare any number of treatments from any number of factors. Now, if an experiment or other study finds a difference in two or more groups, is it really important? Well, if the observed difference is larger than what would have been expected just by chance, then it is labeled statistically significant. So let's look at another type of experiment called a double-blind experiment. Now, this experiment is conducted in such a way that neither the subject nor the investigators working with them know what treatment each subject is receiving. It controls response bias from both the respondent or the experimenter. Now, we got through talking about completely randomized design a couple of slides ago, where all subjects are allocated at random among the treatments. In a pairing or blocking design, you actually group people together. This is to reduce the effects of variation among the subjects. Now, the matched pairs design is used a lot. It compares two treatments. You choose pairs of subjects that are closely matched. You randomly assign one treatment to one of the subjects and the second treatment to the other. Sometimes a pair could be a single subject receiving both treatments. So we could talk about if it's the same person, a person taking the SAT, and then after doing an SAT prep course, take it again, and comparing the scores before and after. That could be a matched pair design. The block design, what the block design does is it groups individuals that are known before the experiment to be similar in a way that it is expected to affect the response to the treatment. Now, in this block design, the random assignment of individuals to treatment is carried out separately within the block. So let's look at an example. Men, women, and advertising. Compare the effectiveness of 3 television advertisements for the same product, knowing that men and women respond differently to advertising. So you have 3 treatments, ads, and 2 blocks, the men and the women. So here we have our 2 blocks, the women and the men, and then the random assignments to the different ads. And then we would afterward compare the reactions. So if you go to page 238, exercise 917, I would like for you to read that particular problem. Just pause the PowerPoints, and then we're going to come back and we're going to describe the design of a completely randomized experiment, and then we'll look at a design of a matched pairs. So if we look at this randomized experiment, what we would do is we'd have these 30 subjects, and we'd randomly assign 15 students the easy mazes and 15 students the hard mazes, and compare the time estimates of group 1 with group 2, where group 1 was the easy mazes, group 2 was the hard mazes. In a matched pairs design, however, a good way to do this would have each student do the activity twice, once with the easy mazes and once with the hard mazes, and then we would compare their time estimates for the easy and the hard. So that's how we would do a matched pairs. So this concludes Chapter 9, a couple of examples, and we will get into Chapter 10 next. Thanks.